second time this month I think I've seen Dr. Cochran, sadly, but this time it's for our sweet Ivy. Dinky, I'm trying to make a video. Very busy here. All right, we just performed surgery and Storm is comforting Dr. Cochran because it was stressful. It wasn't stressful at all, actually.
She just wanted to be a part
but
of it.
Storm very much needs to be a part of it, and they're checking on their girl. This is their girl that they take care of. This is their pony. So you want to talk about what we did and why? Dr. Cochran is here to see Ivy and Lenny on the sloppiest, coldest day that she could have chosen to select this day to be the day, but we're grateful that she's here. Beverly, we don't need any of your help, none whatsoever. It's quite challenging because Ivy does not want to leave her pasture, but we are thinking she's going to have to leave her pasture. Nonetheless, as Dr. Cochran does her exam in the sloppy mud, I've also committed to a new pair of shoes for her because she did not bring boots today. Storm, no, we're not doing that today. I'm probably the most ill-prepared that I have been, and it's simply because Ivy would not cooperate today. Either way, really blessed to have her here. She brought Jemiah with her, and we're gonna see what we can do for our sweet girl. All right, we just performed surgery and Storm is comforting Dr. Cochran because it was stressful. It wasn't stressful at all, actually.
She just wanted to be a part
but
of it.
Storm very much needs to be a part of it, and they're checking on their girl. This is their girl that they take care of. This is their pony. So you want to talk about what we did and why?
Yes, so this mass, we've known that Ivy's had these masses for about 6 months, something
No,
like that.
year.
Maybe a year. Okay,
Yeah.
It's been a long time. We tried to manage them as a worm-type disease that sometimes happens. They did not go away. They maybe showed a little bit of improvement, but never disappeared. She still actually has one on the other side, but it's kind of quiet right now. It's not super ulcerated, it's not sticking out a lot, and it's not giving any discharge. This side, the other reason we didn't resolve it earlier with any kind of surgical intervention was because if it's a sarcoid, sometimes when you cut into those, they don't like it, and it makes it worse. The problem is this: the skin was never going to close over a tumor that was sticking out this far anyway. And I really need to know at this point what this thing is, so I've got an idea of what it's doing to make her so lame, if this is why she's lame. We're going to biopsy this, send it off, try to get some answers, and then based on having answers of what this is, maybe we'll figure out what best there is to do about it. We do know that in this leg she's got a little bit of white line disease in the hoof too. Her farrier is going to come out here and see about that and see if maybe that has a role. In the meantime, she's going on systemic antibiotics to help keep any infection from setting in from where I've cut. And she's also going to go on those antibiotics just to make sure that if it's something else in the leg, which I doubt,
Yeah.
cover that.
She didn't have a fever, which is good news. And she was a good patient.
She's very sweet. The sweetest donkey I've ever seen. Even when she's sleepy.
Yeah, she had to have animal crackers to help her go down, though. That was a necessary event.
It was part of the obligation and part of the contract.
It was. So next steps for us are change this bandage in a few hours.
So she's got a pressure wrap on it now. There's not a great way in the field like this, particularly with tumors. Tumors like to bleed a lot. They create their own blood supply.
That's crazy to me.
It is. They like to feed themselves.
Yeah, that's awful.
Because of that, we're doing a pressure wrap for now, so it's just going to put pressure on it until it stops bleeding. Jamie's going to change this wrap tonight.
And then every day after, like daily afterwards, but once a day?
Yes.
Okay, that's good
Probably
news.
once a day at this stage.
All right.
I don't want her to get to the point where she hates it so much that she doesn't tolerate you messing with it, which is why we're going to start out slow and probably do once a day.
Okay, sounds good. Well, thank you for coming out for her. You know we have one more patient, right?
I do. I'm so excited to see my favorite goat in the world.
What do you call him?
Leonardo the Cape Rhino?
Yeah.
Yeah. That's
All right. Sweet Ivy, we love you so much. We're glad you're going to feel better. We hope.
And thank you
Oh,
for
wait.
your help.
Can we see the thing?
Yeah. Where is it? Where'd you put it?
It is
Right
in that
here.
bag.
And I didn't even introduce you. You're Jemiah. And I also didn't ask you, was I allowed to video you? Are you in the witness protection program? No. Okay. I would have deleted every one of your clips if you told me no.
Okay. So this is our tumor. We actually have 2 slices of it in here. This part was just a section that I cut out deeper after I got the initial big tumor off of there. She wants to see it too.
Oh my gosh. Storm, she's like, you opened a bag. Was there anything in it for me?
She said it smells like.
No.
It smells like it could be.
No. Anyway, so we're going to send that off and see what it's made of, and that'll give us some clues as to what's next as well. Storm, my love. No, none of this is for you, I promise you. Oh
She
my
said,
gosh.
I heard we were giving out animal crackers.
Uh-huh. That's exactly true. Okay. As you can see, it's very dark outside. So we removed the tumor. I'm so disgusting right now. So disgusting. We removed the tumor from Ivy, and she's going to be on oral antibiotics and antibiotics at the site, topical. Thank you for the word, Jamie. Topical antibiotics in addition to the farrier coming Monday, the farrier being Courtney. And we are hoping between pain meds and all of those things that we can get Ivy over this hump. We are sending off her mass to be able to learn more about it. I just spent 20 minutes changing out her bandage, and it is still, like, she had a pressure bandage on it at first, so this one is not as much pressure, and it hasn't formed too much of a clot yet. It is, I mean, just like Dr. Cochran said, tumors grow their own fuel source, basically. So it's not that she didn't bleed through that bandage or anything like that. But either way, keeping a close eye on it. I will change this out tomorrow morning again. I'm going to try to do twice a day tomorrow and then drop it to once a day. Dr. Cochran told me that would be best. Our biggest thing is keeping it clean and keeping the antibiotic cream on it. Next up, Lenny. So Lenny got his splint removed. Lenny has had some muscle loss, and Lenny has, as I had talked about before, some healing things. So Lenny had some wonky healing in his second set of x-rays, which made us keep the splint on extra long and just hope that his bones could heal enough to be able to support. He's a big goat. He weighs 150 pounds. He lost some muscle mass from relying on that splint, and it's also going to change his gait. So Lenny has some relearning to do, but I'm pleased to say he was out there eating with everyone. He was putting a little bit more weight on it than he was when we initially took the splint off, and it feels weird. It's just like when we break a bone and trying to relearn and reuse and everything like that. It'll come back to him. But it's never going to be perfect. He's going to always have arthritis. He probably feels this more. And those tendons and things are going to be stretching a little bit more. So Lenny will always have a limp, the same way that Pebbles had a limp. And we did shoot extra x-rays just to be able to see how that ended up healing. And Dr. Cochran will read those next week after they're processed. I have to give a massive shout out to Dr. Cochran for always being so patient with the circumstances we have. I don't have perfect barn setup or stocks or medical rooms for animals and all the people in the world to hold things. So just being so patient, and all of her help also being so patient with all of our circumstances. It was very cold today. It's going to drop down again to about 26 tonight. So I got babies all bundled up, including Ivy. I did put a blanket on Ivy. Let's see if we can see our sweet girl. There she is, Miss America. Now, I bandaged her back up with stuff that I had. I do have to go pick up some more things tomorrow, but she's pretty excited to have a blanket on. The only thing I don't like about that blanket, it doesn't have anything for the hind leg, so it does creep up on her chest a little bit. Either way, I think it's going to keep her extra warm tonight, and because she had sedation, that can make them feel a little bit colder and shiver. Oh no. Oh no. Oh no. My Storm here was the sweetest nurse trying to help Dr. Cochran out today, as usual. And I really love how she picks out the good people. And she is super worried about Ivy and has really been attentive, right along with Prim, to be honest with you. The girl gang, and I mean, don't get me wrong, Voodoo and Bucky's are her people, but the girls are being very protective of her as well, which has been really special to watch. So all I know is I really want Ivy to get a good rest tonight. There is no rain anticipated, and I really want Lenny to get a good rest, and then hopefully tomorrow I can video some of the things. I will not do the wound change because it was a little bit rough. I gotta go. I just remembered I gotta go unhook some hoses because it's gonna freeze again, and I have them still hooked up. Again, thank you to Dr. Cochran for her patience, her knowledge, her willingness to drive all the way out here because it's not short. And instead of seeing 20 patients in the clinic this afternoon, she saw 2, my 2. So I know that takes a big toll. But it's always good to see her and anyone that she brings. And we're blessed to have her.